welcome back, everyone. That was an energizing panel on global health. And you got to hear about the shifts, right? We got to hear what does it mean for the private sector, what does it mean for a nonprofit, and then what does it mean also when you are leading in the government from the Ministry of Health perspective. We are going to now talk about scaling innovation. And you guys all have the QR code. These are our panelists. They have very amazing bios. And so please go to the QR code. You can read about their backgrounds. But I'm going to get us started. And my first question is for you, Patrick. Patrick, for those who aren't familiar with Vestergaard, can you talk about what your mission is, what your core solutions is, and how you are advancing global health?
Thank you very much, and thank you very much for inviting me. I think this is typical Davos, that you sort of plan out your schedule and then you see something that's top priority and then you change everything. So thank you for putting health and keeping health on the agenda. It's very important. So I work for a family-owned social enterprise with a 70-year heritage of innovating faster than a mosquito can mutate. Essentially, we're about material science and bringing next-generation tools to eliminate malaria. So our mission is really targeted towards ending poverty. So we have really put either the MDGs or the SDGs at the very core of our business, and it really drives absolutely everything that we do in terms of eliminating malaria. A couple of facts. We have manufactured and distributed over 1.5 billion mosquito nets. And so of the 1.22 billion malaria cases averted over the last 20 years, mosquito nets and bed nets, the humble mosquito net, is responsible for averting 72% of all of that. The point being, we work on foundational tools that are proven interventions to save lives. Perfect.
And then, Isha, the next question is for you. So this week, Colgate-Palmolive announced a partnership with the WHO. And as we think about innovation, I think about it in the broadest sense. We have products, we have services, we have platforms, we have partnerships. And so, Isha, my next question is for you, if you can talk about what that partnership looked like.
Absolutely. Thanks, and thank you for giving us the opportunity to speak today. This is very important, this panel. So earlier this week, we announced a partnership between Colgate-Palmolive and the WHO Foundation. This is a multi-year partnership. It is a landmark partnership for our organization and shows that we are committed to oral health in a whole new way now. We are supporting the WHO to elevate and scale oral health in the broader health agenda. And there's 3 points of the partnership. The first one is to scale oral health education. So that looks like integrating oral health into school health programs, teaching children how to brush their teeth around the world in over 100 countries. And the second pillar of the work is to help the WHO, support them to develop their evidence-based technical guidance for countries and ministries of health to integrate oral health into existing UHC agendas. So this is around policy and advocacy. And then the third is just making the case to elevate oral health in the broader agenda, which means highlighting the fact that today, 3.7 billion people around the world suffer from oral health disease, and that is half the world's population, making it the largest non-communicable disease as well. So this is a growing problem. It's a big problem, but unfortunately, in the broader health ecosystem, we're still seeing a disconnect between oral health and systemic health. And so this is our step towards elevating that and making sure that we are addressing the challenges.
Yeah. And that segues nicely. So we talk about over 3 billion people, oral health challenges. And Charles, you're with HealthCois, and I know you think deeply about primary care, and I know you innovate and invest across the board in the spectrum. But could you talk a little bit about some of your investments and maybe what you're excited about in terms of the innovation that's coming?
Thank you. So at HealthCois, we've been investing since 12 years in Indian companies that address the healthcare needs of the 50% poorer Indians, while at the same time aiming to generate 30% IRR for our investors. And we've managed to do so in Fund 1 and in Fund 2, and we're getting ready to do that in Fund 3. So we invest in health tech, in med tech, in life sciences applied to low-income populations, and we invest in healthcare delivery. So across all the different possible activities of healthcare. So it's purely private capital that's supporting entrepreneurs who are in their early days to in their early or slightly more mature days. The goal is for them to scale and in the end reach an improvement in access, in affordability, in quality of care of the 50% lower income strata of India, which has very similar needs to the needs of the 4 billion poorer on the planet. Now to your question, finally, I apologize for this long introduction. Well, we have some innovations that obviously leverage AI, like Cure AI, that started as a TB diagnosis company. They're now present in 100 countries in the world, and there they diagnose TB in 2 hours instead of 2 days and 60% cheaper. They jumped from TB to lung cancer. And with AstraZeneca, they partner for detection of lung cancer in LMICs. But in the US, they got approved, 19 US FDA approvals, and there they're partnering with other pharma companies, a large number of US hospital chains, payers, in order to diagnose cancer care earlier. They're also partnering with Siemens in certain cases. Another example of one of our portfolio company, just a last word on Cure. What's interesting is that designing an AI algorithm in India is 1/6 of the price of an AI algorithm designed in the US. And it works in all geographies of the world, as you see in the case of Cure. But the needs of the 4 billion poorer are all over. Now, a second case, which is more India-centric, is AI applied to dermatology. So Cure Skin, another portfolio company of ours, they use AI to diagnose dermatological ailments. They confirm the diagnosis with a telemedicine service. The telemedicine service has a small AI tool that links the patient to a woman or a man, a doctor available at that point in time in one of the 100 places where we have some in India who are from the same culture, who have the same language, so that the diagnosis is then confirmed. And then the company ships to them in a B2C mode, because 80% of our patients are based in rural or semi-rural India, drugs that they contract manufacture, Cure Skin. And by contract manufacturing, they have a 65% gross margin. So phenomenal company, scaling as well like wildfire, because obviously the needs in dermatological ailments are not at one place. They are all across India, but 80% of India's dermatologists are focused in the metro towns. So the rest, 20% dermatologists, are supposed to cover approximately 80% of the population. With the difficulties of access and roads, you imagine the complexity.
Yeah, thank you for that. And I'm going to ask you to share your mic with Bjorn. I recognize we're one mic short. And Bjorn, can you tell us a little bit about CareSyntax and the innovation that you're most excited about?
Sure. So CareSyntax is a surgical intelligence company that we founded about 15 years ago. And I originally wanted to be a surgeon, so failed at that attempt because of, actually, interestingly, I have shaky hands. So you will notice that in this panel as well. But that was the reason why I switched out of medicine and went into business and entrepreneurship. And with CareSyntax, we are providing high-density edge compute systems into operating rooms that can absorb very large amounts of video and other data sources. both extracorporeal and intracorporeal video, so both outside what's going on around the patient and inside. And the objective is to make surgery safer and smarter and scalable. And the reason for that is because, to the access point, 6 billion people don't have access to surgery today in the world. And that's because it's very expensive. And the infrastructure at the moment is not, and the way the service is delivered is not scalable. So it's a basically supply side problem. We don't have enough surgeons. Even if we had all the money in the world, we couldn't solve that issue. And so our objective is to make it safe and scalable by having software tools and automation tools that are deployable in today's healthcare infrastructure and also in frontier markets. And I'm very excited about that. And we are currently in 4,000 operating rooms, and so we are processing around 3 million surgeries per year, or supporting that, and are collecting now a lot of interesting and relevant data.
And that's interesting, right? So not only are you having a solution, but then there's the data, and how will you innovate with the data, and how will you sort of provide deeper information?
Yeah. So the first issue is that there is really no systematic data collection in the operating room. So when we started in 2010, we had to build this infrastructure. So we built a solution that is a kind of in-wall or box that has this tech inside, and a software solution, and that is the way that the software is then delivered into the operating rooms. And the data is collected as almost like a waste product in a way. So because we are in the clinical workflow, we know exactly what the surgeon sees and what the team is doing, and it is very unique, esoteric data that is basically unavailable anywhere else. So we are probably we're the only company that has access to this type of data at scale in the world today. And there's of course hospitals that have that, but and provider systems. But let's say J&J or Medtronic, they are unable to get data sharing agreements with hospitals, especially around financial data, because the hospitals know if they give them more data, they're going to even take more of the profit share, which is mainly in surgery, is mainly going to medtechs. And so hospitals are very wary of sharing this data, and we can come in and provide a solution that helps them day to day, but also provides them the data back that they need to manage this extremely critical place in a more efficient and effective way. And then we are also selling that data to medical device companies to market their products, so comparative studies and so on, but also to develop new products. Robotic systems, for example, are of course very much now being brought into surgery, and yeah, there's a lot of money to be made, so that a lot of people are interested in that.
Yeah, thank you for that. So each of them have received, beyond the prototype, we've received the demand signal, and now we're talking about scale. And if we can go back to malaria for a second, Patrick, the demand for malaria, incredibly significant. We've seen some cuts in malaria this year. But as you think about scaling, where are you relentlessly focused? Is it on technology? Is it delivery models? Is it partnership? Is it production? But we all know scaling requires that relentless focus.
So I think it's about private sector's ability to accept risk. I'd like to take you 20-something years ago when we innovated sort of the first next-generation insecticide-treated net, because it was low-tech, easy to scale. When I started with the company 23 years ago, we were probably producing 1 million nets a year. Within 5 years, we scaled up to 120 million mosquito nets a year. And that's because we took a risk. But we took a calculated risk because it was the right thing to do. It was our obligation. We felt that we had the core competences in terms of material science and innovation to to get a proven tool out to the hardest to reach populations across sub-Saharan Africa. So being, highly entrepreneurial, we are willing to accept risk, a level of risk. And we understand Africa. I've lived both in the Middle East and Africa for 2 decades, so we understand the level of risk. Now, to your question in terms of what is needed, well, all of the above, for sure. And one way to address it is to look at 220 million mosquito nets are distributed on the African continent every single year. About 200 million are imported from Asia. That makes no sense whatsoever, that the single continent that has the greatest demand for insecticide-treated bed nets doesn't actually have local manufacturing facilities. And I certainly spent a couple of decades arguing for why I felt it was important to continue manufacturing in Asia, because it was cost-efficient, it was effective, and so on and so forth. But COVID laid bare why that simply can no longer work. So it was essential for us, and we felt it was an obligation to then start discussions with malaria endemic countries in Africa to understand where would be the right place to localize manufacturing of mosquito net, and not do the sort of traditional Western model of tech transfer and repatriating profits and saying, well, good riddance, right? So we spent a long time sort of really discussing with companies and countries, and we landed on Nigeria. And so in December, we launched our project to locally manufacture bed nets in Lagos with the government of Nigeria. And the first nets will be produced in April 2026. And so we're moving really fast on this. And this is critical because you need to have skin in the game. It's absolutely essential that a private sector company puts, if you will, the money where its mouth is. However, there's a level of jeopardy. And that is that we are operating in a notoriously difficult to read market. The visibility and the predictability, and certainly 365 days ago, this was an existential moment for malaria. We thought the funding was gone. We thought the funding was cut. So it's important for us to understand, if we make an investment into local manufacturing, as an example, what do the next 10 years look like? We're not entirely sure. So it's been very, very difficult to go to the board of directors and the management and say, hey, would you mind sort of investing $30 million into this? Because we think it's a really good idea. And to your point, because the need for bed nets is so important. The need to eliminate malaria is so critical. So that's work in progress. This project is not solely financed by Vestergaard. We have Gates Foundation involved. We have MedAccess. We have US Development Finance Corporation that are also putting skin in the game. And I think that's part of the previous panel that was talking about, or 2 panels back, talking about these global compacts that the US is signing essentially with a number of countries in Africa, that we have to help that transition to self-dependency. So I hope I've kind of painted a picture of the level of risk that we're willing to accept and how that is so important, because in that period of scaling from 1 million mosquito nets manufactured in year 1 to 120 million and now 1.5 billion, we've halved deaths. And essentially averted, like I said before, 1.2 billion malaria cases. So we have a foundational tool that can unlock GDP. It's as simple as that. If we can eliminate malaria, we can unlock $4 trillion worth of GDP on the African continent. That's a good argument. Thank you.
Yeah. And I am such a big believer that the healthcare industry is an economic engine. When you have healthier communities, you have a more productive society, you grow GDP, you create jobs, and we saw the inverse of that. We saw COVID-19 happen, and we saw massive job loss, we saw GDP decline. I really think that is such a great example of what you guys are doing in Nigeria. Isha, what's really interesting about the program that you just shared with us is that it's across a number of countries. And when you think about scaling, right, it's so important. We all know healthcare is so localized, so much focused on your counties, your zip codes, et cetera. So tell me, how are you bringing in that localized aspect when you think about scaling this program?
It's a great question, and I will speak to that by sharing an anecdote about a specific program we have, which is called the Colgate Bright Smiles, Bright Futures program. So Colgate has been quietly working and doing this work through the program for over 35 years, so since 1991. And we actually celebrated an exciting milestone last year of reaching 2 billion children and their families around the world with oral health education. And the way we do this is through a core set of education assets. We go into schools, we work with teachers who work with parents, who work with children, and that's one model of the program. And in some countries that works, and in other countries we have to go through community partners. So we have to go through NGOs who are holding, let's say, health events, and that's where we work with nurses and healthcare workers to then train parents and work with children. Sometimes we can do this as Colgate-Palmolive. Sometimes we can do this through local health systems. Sometimes these partnerships come through ministries of health and education. And I think this is a great example of, we know we can't do it alone, nor should we, because we have to form partnerships to scale work. But in some countries, the trusted messenger is the government, and in others, it's doctors, and in others, it's teachers. And so I think that's a good example of how we tailor the program to local contexts. So our team in New York works on the global strategy. Then we have 5 regional teams, and one of our regional leads, Irina, is here today, who oversees all of Europe. And she then has country leads for each of the countries she's in. So this strategy trickles down. And we give the guardrails of the program. So we say it's important to form partnerships. But then we give them guardrails on, if you're going to work with an NGO, let's focus it on NGOs that focus on children, education, or water, because you can't brush your teeth if you don't have access to clean water. Then we say, if you're going to work with the government, this is how you can systematically do it. Understand the universal health care law. Think about how you can elevate oral care into that law, and then systematically work with them to integrate it into existing health programs. So it's nuanced, and it is hard to ensure that it is all a cohesive strategy, but it is very important for public health programs to be able to have a global strategy and then trickle down and be localized.
Absolutely. Next question is for you, Charles, right? So we talked about what does it take to innovate and scale, and we know government becomes a really important aspect here in terms of what are the tailwinds you're receiving. And so in India, there's a big push towards digital health. And can you talk about how those tailwinds have maybe shaped some of your investing?
So in India, first, there's been Ayushman Bharat, so Modi Care, that originally was covering approximately 120 million Indians, and now is covering 550 million lower-income Indians. So that sort of opens the door to universal healthcare coverage, while India is still not there yet. But it at least opens a section. Now, Ayushman Bharat also has a digital health mission, and that digital health mission, which is driven by the government, is attempting to facilitate the use of health tech by doctors, by hospitals, by patients, and the family of these patients. So they can find there a repository of hospital chains, individual hospitals. They can find guidance on when you have a certain disease, what is it likely to be, what could be a second opinion that you could get. As a result of that, plus obviously, and it's structured in a way so that the private sector can come and plug itself on it. And if you are a health tech startup, you can use that platform to offer your services and to scale faster. So what did it lead to? It led to, before COVID, in India, there were approximately 150 million digital health account holders. So 150 million individuals who had decided that their data and their care would be digital. After COVID, the number was 350 million, and now it's 750 million. In most Western countries, because we have a higher number of doctors, nurses, and beds per population, the number dropped after COVID, while in India it doubled. And it's on its way. The growth continues to be stellar. So that's obviously explaining why we see so many startups and mature companies now who've become household brands, and why private equity investors and not only venture capital investors, and why large tech companies or large Indian conglomerates all want to buy companies active in the space, in the Indian health tech space.
Thank you. And the last topic I want to touch upon is whenever we want to innovate, we need financing, right? And Bjorn, maybe I can turn my last question to you before our final question to the panel. Can you talk about what the financing environment is, and when you look at the capital stack, what your long-term guidance would be for those who are looking to innovate and scale?
Sure, and I think the panel here is an amazing example of success. And what Charles talked about are success stories, but these are very rare. So I would say that the vast number of digital and biotech companies just don't make it. And there's a lot of very good synoptic ideas and concepts that get funding, but that have no systematic, let's say, go-to-market approach, and don't ever figure out actually how to deliver enough value to be bought at scale by health systems or adopted, because because basically you need a product that has an extremely high ROI and that really helps the front line, et cetera, et cetera. So that's, I think, one topic that I would observe, that many companies get funding and then don't figure it out. I think the second observation that I can share is, and we did this with CareSyntax, we raised north of $500 million for this, and with all the good investors, everybody was so super happy when they put money in 2020 and 2021. And so we had too much money, and then we spent it on a lot of different things, and the company didn't materially grow, and so that became a massive problem, because then we had 400 million liquid pref, and the solution to that I see, which I think is a very good financing solution, is senior secured debt. And if you look at let's say the capital structure of most biotech companies, the duration of the investment made into the equity and into the debt stack is usually far too short. So that's kind of a long-winded way of saying I think we need a much better product for the capital markets. And I think that this product has to be, on the one hand, senior secured and then maybe structured equity. And with that, we can increase the addressable markets very significantly. I would estimate 10 times the addressable market to raise capital for health tech solutions, because family offices and, let's say, a lot of larger managers of patient capital, they like risk, but only if somebody else takes the risk. so we need we need something that looks, at least from the outside, quite managed in terms of risk, and that still has a long enough, let's say, horizon for companies and entrepreneurs and innovators to make it in healthcare, which takes 10 years plus.
Yeah. Absolutely. And I will say one of the themes that I've heard, this is day 3 for Davos for me, is we continue to talk about uncertainty, right? There's been a lot of uncertainty, a lot of shifts, and scaling is easier in predictability, right? And when you have the amount of uncertainty that we're facing, I'm curious if you could all take a second and maybe one sentence of how you're thinking about scaling in times of uncertainty. and I don't have to go in order, but welcome you guys to share.
Please go.
I can start, and I will say that for us, it is public-private sector partnerships. We can't do it alone. We shouldn't have to do it alone, and we can go farther if we go together. In my second line, if I may, I would like to just share that there is a $4 trillion gap in meeting the UN SDGs by 2030, and those resources exist in the private market. And so an organization like the WHO Foundation has made it possible for Colgate-Palmolive to partner to support the WHO to do the good work that they're already doing with our support and our leadership in oral care. So I think it all comes down to collective action and working towards a common goal.
Vestergaard has an R&D innovation platform that is primed to, at minimum, bend the curve on malaria and potentially even alongside a suite of other tools, eliminate malaria within our lifetime. And so to your point around visibility and predictability, the single constraint to unlocking that potential is, of course, funding. The traditional funding models, they're gone. So it's our ability to partner with governments in particular, right, who are expressing sort of the future demand for our tools. So we've got to get a lot closer. We have a strong footprint in Africa, and so we've really got to build our relations and give them a reason to continue investing in our products and deploying our solutions. Thank you.
At HealthChoice, we work very hard to help our companies scale profitably, because free cash flow is happiness and freedom.
Word. I would say, fully agreed, profitability is the key, and healthcare has to be profitable, and everything that we're doing has to generate cash flows. It's not a charity, and if the organizations, be it non-profits or profits, are not making profits, they're not sustainable and they will die. And so it's really important that that I and others, because I came from a space where profits didn't matter, so there was no discipline, and in tech, and for a period of time, and that really led to organizational death in several companies that I was involved in, and so profitability is the key, and it has to be okay to talk about it, and it has to be okay to be the primary focus. And that's very difficult because obviously we're dealing with human health, and that's the most important good. And we want everybody to be healthy, but without the profits, it's not going to work out. So we have to make that happen.
All right. Well, that's all that we have time for. Thank you, everybody. It was certainly a wide example of everything from oral health, malaria, primary care, surgical care, and what it takes to innovate in these volatile times. So thank you very much, everyone.
Thank you.